I'd like to say good morning. My name is Kim Walsh. I'm a Deputy Commissioner with the Bureau for Behavioral Health and Health Facilities. And I just want to say thanks for having me here this morning. And I'm going to start off with a couple just housekeeping things and then speak to you for a few minutes from the perspective of the Bureau and offer some thoughts for the day. Let me begin by first also saying that an important member of the West Virginia Partnership for Community Wellbeing is unable to be here today. First Lady Gail Manchin had every desire to be here this morning and unfortunately was called away to something that required her attention today and therefore cannot be in attendance. So she asked that I convey to you her personal regret in not being able to be here, but encourages you all to have an enjoyable couple days and hopes that you leave here nourished with information from this workshop. With that said, welcome to the 2009 Share the Vision Conference. The conference is in its 17th year and is dedicated, as you know, to bringing partners from across the state together to raise awareness, share essential knowledge, and provide opportunities to collaborate toward resolution of substance abuse prevention issues impacting our citizenry. On behalf of the West Virginia Department of Health and Human Resources, the Bureau for Behavioral Health and Health Facilities, I want to thank the West Virginia Prevention Resource Center for their work in coordinating this annual conference and for their dedication and leadership in developing and establishing substance abuse prevention efforts statewide. In the past few months, I've had the opportunity to meet and get to know members of their staff. I am honored to have them as partners in this complex environment, requiring all of us to work together and find solutions that carry us forward in resolving issues like prescription drug abuse, which we hear so much about, underage drinking, which continues to persist, pregnant women who are addicted, and the impact of substance abuse on overall health of West Virginians. I am a firm believer that together we can accomplish anything. I have spent many years in the private sector working to establish collaborations of diverse groups, build coalitions, and bridge opportunities to achieve success in developing continuums of care that truly attend to those needing services and support. I have spent my career, and you know, if I tell you how long, you go, oh my. I start telling on myself when I do that. Dedicated to improving the lives of others and have made no secret, and for those of you in this room who know me, I have made no secret of the fact that I am intent on making this happen for my extended family of fellow West Virginians. As the Deputy Commissioner of Programs for the Bureau for Behavioral Health and Health Facilities, I am keenly aware of the myriad of issues that are complex and facing us today. Over the past few years, the West Virginia Comprehensive Behavioral Health Commission, appointed by and recently extended by Governor Manchin, reviewed the West Virginia behavioral health system towards the development of an improved, comprehensive, and cost-effective system of care. With over 100 recommendations resulting from this group's work, the final report emphasizes prevention and early intervention, as well as a need for community-based care. In line with the Commission's work and resulting recommendations, and as the federally designated single state authority for substance abuse prevention and treatment services, our office takes seriously the leadership role that we have and must carry out. In so doing, our office funds through both federal and state dollars prevention and treatment efforts supported in part by federal substance abuse block grant dollars, provided through the Substance Abuse and Mental Health Services Administration. This block grant provides nearly $9 million that is prepared with equivalent state dollars and other sources to fund the prevention and treatment services continuum in West Virginia. Current funding supports a multitude of programs comprising the existing continuum of care. Those programs include adolescent outpatient services, adolescent outreach services targeting youth at risk for substance abuse, adult outpatient and inpatient services, women's outreach and linkage services, residential services specializing in and targeting care for pregnant women and their children, mentoring services as well as mobile supportive intervention services for adolescents and their families, intensive treatment for adolescents with co-occurring diagnoses, placing them at risk of hospitalization or school expulsion, suicide prevention programs, transitional living programs, school-based linkage workers providing prevention and early intervention services for youth, mock trials that support youth to learn through education about substance misuse and abuse, regional clearinghouse operations supporting the continuous dissemination of materials, and prevention capacity building through statewide community development efforts, as well as SINAR inspections supporting retailer education and geared to reduce the sale of tobacco products to underage youth. Now, again, if you know me, you know I could go on all day talking about what's going on, but I recognize that we, in fact, do have a wide range of efforts out there to focus on both adolescent and adult populations, as well as prevention, early intervention, treatment, and recovery. And while I'm pleased with that and what has been accomplished, and I commend those who work tirelessly in our communities throughout the state to make that happen, I recognize that there's a greater and increased need for effort that's geared to support our collective ability to address the growing and ever complex substance abuse issues before us. It is no secret that West Virginia is faced with some alarming statistics regarding prescription drug abuse, and that substance abuse in our state is costing us dearly. And when I talk about costing us dearly, I don't just mean that it's costing us financially, it's costing us in many other ways. Families are hurt by this, children are hurt by this, families are destroyed by this, and we know that. Reports have been published, and while they may vary in their assessment of West Virginia's use and abuse issues and the costs of same, one fact remains: our children and youth need us to pay attention. Mothers and fathers, sisters and brothers, uncles and grandparents need us to pay close attention. The time to ponder whether an issue exists has passed. The time to band together and walk the same path and talk the same talk has arrived. Those depending on us to act can wait no longer. With this said, I am so pleased with the Governor's Drug Summit held yesterday at the Clay Center. I want to thank Governor Manchin and First Lady Gail Manchin for their support and applaud efforts of the West Virginia Prevention Resource Center and the West Virginia Partnership for Community Wellbeing, of which I am a proud member, by the way, for planning an event that led many West Virginians together to share in a day of reckoning, resulting in a collective commitment to work together. Yesterday, it was evident how deeply we all care about this issue. The result is stronger and a more invigorated group of men and women who pledge to work together, support one another, to prevent substance abuse, and support one another to provide early intervention alternatives and comprehensively provide for substance abuse treatment and recovery in this great state. Again, on behalf of the Bureau for Behavioral Health and Health Facilities, I thank you from the bottom of my heart for making time to attend this two-day event. I hope you listen and learn and grow and return to your respective communities, excited and ready to share your vision with others, engaging them in the quest for wellness and recovery in West Virginia. I thank you so much, and I really do sincerely hope that you enjoy the next couple of days. I'm going to be around some this morning and would be happy to talk with any of you. If you have questions, if you have concerns, I would be more than happy to entertain those. I really just cannot thank you enough for being here.